We often hear the message, we have everything we need inside of us. But how do we access it? Conscious Connected Breathwork is a powerful therapeutic technique that shows us how true that is and how we get to that inner knowing and guidance. I'm Dr. Coral Westerway, a clinical psychologist who works at the interface of mind, body, energy and spirit. And in today's video, I'm going to share Conscious Connected Breathwork with you, discuss the process, what a session looks like, and what you need to know before you delve into this powerful practice. We're going to think together about the practicalities, what you might experience, how you manage and regulate the process, and we're going to think about some safety considerations. You might be aware of the recent resurgence in research into psychedelic assisted therapy, accessing non-ordinary states of consciousness, the subconscious, the unconscious, to really move through challenges that are stuck. When I learned that we could access non-ordinary states of consciousness through Conscious Connected Breathwork, and I had some profound experiences of my own, I was absolutely captivated, wanted to learn more. And I embarked on a 10-month training with 7 Directions Breathwork. So the content in this video has come from that training, with absolute credit to Steph and the team, but any inaccuracies are my own and not a reflection of them. This powerful practice is finding its way more and more into the mainstream, and that is wonderful. But not all facilitators give a really thorough frame. So I'm going to give you the information you need here to set you up to manage a session. It's really useful not to have eaten too much before a session. We say nothing too heavy in the 2 hours before a session. Wearing comfortable clothes, relatively loose fitting, no restriction around ribs or lungs or waist, so that you can really take those full deep breaths. There are a number of physical and psychological health conditions where there are contraindications or considerations that need to be made if you're going to embark on Conscious Connected Breathwork. So if you have any physical health challenges or any psychological challenges, it's a really, really good idea to have a conversation with your breathwork facilitator first, to really think about the impact of the practice, your safety, your well-being. Often the practice can be modified to minimize any risk of adversity to you. So particularly if you have any of the following conditions, please consider a modified practice, just an exclusively nose-based breath for the connected breathwork. Schizophrenia, unmedicated bipolar or psychosis, unmanaged PTSD, epilepsy or seizures, heart conditions or arrhythmia, COPD or pre-existing lung conditions, delicate and or first trimester pregnancy, high blood pressure, very low blood pressure with fainting history, severe asthma, glaucoma and or detached retina, severe osteoporosis or recent major surgery, panic attacks or high levels of anxiety currently, or any other health conditions, or if you're taking any medication or you're microdosing. Again, these are all things to discuss with your facilitator. And if you're experiencing any of those, for safety, it's best to exclusively breathe through your nose in the Conscious Connected practice. So what does Conscious Connected Breathwork mean? So the conscious bit is that we are mindful, that we are very present with our breath, that our breath brings us into this moment. Throughout the practice, our awareness should ideally be with our breath, with the inhale, with the exhale. And any time throughout the practice that we notice our thoughts or our mind wandering off, just gently bringing our attention back to our breath. The connected part means that each inhale flows directly into the exhale. So rather than regular breathing, where we breathe in and pause and breathe out and pause, in connected breathwork, we lose the pause at the top and the bottom of the breath, and the breath flows in a continual cycle. The most activating of the connecting breath is open mouth breathing. So with a soft jaw, opening the mouth fairly wide and breathing in and out through the mouth in a connected rhythm, something like this. Losing the pause at the top and the bottom. Not forced, not laboured. It's a bit hard doing it under pressure when you're being filmed. But a gentle but deep inhale flowing into the exhale. It's like the waves at the sea. The inhale washing into the shore and the exhale just passively coming back out again. In and out in a continual cycle. As I mentioned, the most activating breath is in and out through the mouth. But as I said with the contraindications and different health presentations, we can also do conscious connected breath through our nose. In through our nose, out through our nose. Or we can do a combination of in through our nose, out through our mouth. I'm going to speak about how we can increase the activation and how we can decrease the activation. Because as I said, conscious connected breathwork can be a very powerful practice, and it's important that we know how to regulate as we go along. So when I'm delivering conscious connected breathwork, I start with people in their regular breathing rhythm, just settling into their bodies, into the practice, being with their breath, being with what's present. And then I invite people to start connecting the breath through their nose. So finding that connected flow and rhythm, but through their nose. Then I invite people, if they're choosing to move to a connected mouth breath. As I said, softening through the jaw, opening the mouth, and breathing in and out through the mouth in a continual flow. Now, at any point, if you choose mouth breathing, you can slow things down again by coming back to connected nose breathing, by returning to regular breathing, or by extending the exhale, slower and longer on the exhale, toning and humming on the exhale, which activates the vagus nerve and calms our whole system down, or pursing your lips and breathing out as if you're breathing through a straw. Again, extending the exhale. So if at any point through the practice you're feeling like things are getting a bit much and you just want to slow it down, or you decide that you want a more gentle practice, you can choose any of these methods to slow and calm things down, or you can stick to connected nose breathing. It's your choice in each moment. Me or whoever is facilitating might be inviting moving to mouth breathing, but there's no obligation. You tune into what's right for you in each moment. We can experience lots of physical and emotional sensations through modifying our breath. In conscious connected breath, we can experience physical sensations such as tingling, such as the sense that energy is moving in our body. rapid temperature change, either getting very cold or getting very hot quickly. It's always really useful to have extra blankets and layers to hand. And we can experience something called respiratory alkalosis, which is a cramping or a tingling at the extremities. This can bring cramping into our hands and our feet, and we can experience something a bit like claw hands. This is called tetany, and this can be linked to a more laboured exhale. So, important to say, this isn't dangerous, it isn't permanent, it will release and relax, but if at any time it's feeling unpleasant, you can return to nose breathing, extend the exhale, return to regular breathing, or you can bring more softness on the exhale. So really trying to soften through that exhale. With any of these experiences, it's useful to bring our attention with kindness, with compassion, with curiosity, with gentleness, and bring our breath to the experience. So anything that's going on for you, bringing our breath, our attention there, can often invite it to move through or change in some way. We can also experience the full range of emotions, from grief, sadness, anger, to deep joy or a sense of connection to something bigger than us. We can drop into old memories, nice or more challenging, and experience the emotions or the physical sensations or the visuals or the sensations that went with those experiences. We can reconnect with old injuries or accidents and experience the physicality of that. All of these things are possible, and we might experience nothing. Remember to regulate for you using your breath. And another way to self-regulate is to connect to internal resources. If you can find somewhere comfortable, familiar in your body to connect into, that can be a beautiful resource. Some people find bringing a hand to the heart or the belly or giving yourself a hug can be really nourishing. But for some people, connecting into body doesn't feel good at all. So we can bring to mind a supportive other, whether that's a person from real life or fantasy or fiction or spirit. Bringing that person to mind, bringing them into your experience. Or we can connect to a place or a pet, an object or an image to connect us into those feelings of familiarity and comfort and bring that into the moment. I forgot to say that sometimes with open mouth breathing we can get a dry mouth. That's really normal. Often it will pass, but any time you want to close your mouth and bring your tongue to the roof of your mouth to get the saliva going is absolutely fine. If you're doing an in-person breath work, then touch might be an option. I hope that your facilitator will have a conversation with you and invite informed consent about whether you want touch or not. It's really important to know that it is your choice whether you want touch or not, and you are always okay to say no. Even if you've said yes to touch at the start of the session, if when somebody comes round it doesn't feel right or it's not wanted, then just say no, and that should always be respected. And if that is not respected, then there's an issue there, and that is a conversation to be had either with that facilitator if that feels possible, or with a wider professional body. So remembering that you can come back to your resource at any point in the session is a really useful thing to have as you go in. It might be nice to start there before you begin the practice. It's useful to know that this practice can bring a lot up, so it's really good to think about what happens after the session. Some people find journaling really useful, getting out in nature, having a drink, hydrating, flushing it all through. But sometimes we need a bit of extra support. So pre-planning, who can you talk to, who is around, who can you access, and knowing that if it's a real struggle, where you can go and where you can get support. If you don't have access to any support after the session, then please go slowly and gently. This is a powerful practice and it can take us to places we're not expecting. Take it slow. There's no rush. You can always come back here and use this practice time and time again to go deeper and further. Connected breathwork might bring a desire to move, to shake, to stretch, to move our bodies in ways that release or connect. So much is held in our body, and we've so often been conditioned to be still and hold it all in. And as we connect more deeply through breathwork, we may get the desire to move and release. I say really honour that desire, really listen to what your body needs. If you find yourself going off into the movements, keep coming back to the breath. Remember the breath as guide and as anchor into this present moment, but listen to and honour your body. You also might find sounds want to come. We move and process old things through our body through sound and movement and breath. So I say that is really, really welcome. You might want to consider who's around and who can hear, but hopefully you're in a space where you can make noises and you can let that move through you and out. Some people like to have their breath practices laid down. Some people like to sit up. Some people like to move between the two. Sometimes shifting position can really keep things moving. We can sometimes get into a loop with our movements, our experiences, or sounds coming. And actually shifting our body, changing position, trying something different can move that or change that, so we're not kind of looping or getting stuck in something. If you're breathing with me, or whoever is facilitating your breath, I or they will be offering words, prompts, some guidance. But it's important to say that our words are only there as invitations. Take what resonates and leave the rest. Be with you and don't worry about what is being said, unless it feels like it really enhances your practice. My invitation is to let go of any expectations, even when you've done conscious connected breathwork before. Each breathe is different and we never quite know where it's going to go. Some people like to set an intention for their breathe or have a sense of what they want from it, but I tend to just love to be open and see where I go, see where I connect into. There's no right or wrong in this. The process of the session, my sessions tend to be roughly 40 minutes of breathwork to music, and the music starts more gently, rises to a peak, and then gently returns down the other side. On the other side, there's a lot of spaciousness. I really invite you not to rush back from the breathwork to the room or the screen, or feel you need to instantly connect with whoever is present. Take your time to come back into your body. When you open your eyes, giving yourself time to look around the space, reconnect, be gentle. Lots and lots of hydrating. Some people really like to journal once they've come round. Now I will leave space for sharing anything you want to share, but no expectation, no pressure, and most facilitators will do that as well. I ask anyone who breathes with me to really honour confidentiality. I won't share anything that happens outside of the room, and I ask that you don't either. Of course, you can share your own process with other people, but please don't mention who was there or anything that they experienced or shared. The invitation is to breathe into discomfort, to be with it, but also honour your comfort, honour what you need in each moment. I hope you have a wonderful experience with Conscious Connected Breathwork. It is a powerful practice, and each practice takes us deeper. There's no right or wrong, and it can take us a while to drop into our breath, to drop into the presence, to drop into our process. Be kind, be gentle with yourself. And if you've got any questions about any of this, please just drop me a message. I'd love you to join a breathwork practice with me at some point, or the wonderful Steph Magenta runs free Conscious Connected Breathwork sessions every Saturday morning. Love and best wishes to you.